Post-Operative Instructions, dental implants. For the first 24 to 48 hours, do not disturb the implant. Vigorously rinse, swish, or spit. Smoke. Bleeding. Some bleeding is expected after any surgical procedure and is a normal part of healing. You may have bleeding and/or redness in the saliva for 24 to 48 hours. Gauze will be provided to you to help control bleeding following your procedure. You will need to moisten the gauze with ice-cold water, squeeze out the excess water, and bite down with firm pressure for 20 to 30 minutes. A small amount of bleeding can continue intermittently for a few days, especially if the area is stimulated by movement. If stitches were placed inside your mouth, they will dissolve on their own in 7 to 10 days. Any physical activity will raise your heart rate and increase bleeding, so minimize any exercise for a few days following surgery. Swelling. Swelling is also a normal part of post-operative healing and can increase for 2 to 3 days following any surgery, slowly resolving after this. You may apply an ice pack to the area for 20 minutes at a time for the first 24 hours. This will help minimize pain and swelling during this time. After 24 hours, you may switch to warm, moist heat. Medications. If you have been sedated for your procedure, you may not drive for 24 hours. You may also have been prescribed a narcotic pain medication. If so, you also cannot drive while taking this. An antibiotic mouth rinse, Paradex, may have been prescribed to help keep the area clean. If so, do not use until the morning after your procedure to avoid stimulating further bleeding. If an antibiotic was prescribed, make sure to take as directed and until completely gone to help prevent infection. Pain. You should begin taking pain medication as soon as you feel the local anesthetic wearing off. For mild to moderate pain, ibuprofen, Advil or Motrin may be taken. Ibuprofen bought over the counter comes in 200 milligram tablets. 3 tablets may be taken every 6 hours as needed for pain. For severe pain, the prescribed pain medication should be taken as directed with food. Do not take any of the above medications if you are allergic or have been instructed by your doctor not to do so. Diet. Hydration and nutrition are important for healing following surgery. You may be more comfortable with a soft diet initially, but you can eat what you like. You are only limited by your discomfort. Stick to cold and/or soft foods and liquids while you are numb. Remember to always eat prior to taking any pain medication to avoid nausea. Return to a normal diet as soon as possible unless otherwise directed. Oral hygiene. Good oral hygiene is essential to healing. You should begin using the prescribed mouth rinse, Paradex, as directed the day after surgery. Continue brushing and flossing your teeth with a soft bristle brush. You may brush and floss the night of surgery. Remember, no vigorous swishing or spitting. There may be a metal healing abutment protruding through the gum tissue. You may brush and floss around it. Just be gentle initially. Activity. Keep physical activities to a minimum immediately following surgery. If you are considering exercise, throbbing and/or bleeding may occur. If this occurs, you should discontinue exercising. Keep in mind that you are probably not taking in normal nourishment, which may weaken you and further limit your ability to exercise. Limit any vigorous exercise for 24 hours after surgery, as this will increase blood pressure and may cause more bleeding from the implant site.